Holmium Laser Enucleation of Prostate, or HoLEP, is a minimally invasive surgical technique that's used to treat large obstructing prostate in men with bothersome urinary symptoms. We're really excited here at Emory Urology to have added this to our treatment options for men with obstructing prostate. And we started our program in 2019 and became the first in the state of Georgia and the city of Atlanta to offer this for men in the area. HoLEP can be an option for men who have bothersome urinary symptoms, including slow urinary stream, sensation of incomplete emptying, or in some cases, waking up at night to urinate. And for those men who have failed medical therapy or simply don't tolerate the medications, this could be an option. There is a much more significant benefit for men with really severe bothersome urinary symptoms, including recurrent urinary tract infections related to incomplete bladder emptying, if you have recurrent bladder stones, or men with urinary retention requiring a catheter. HoLEP is the best benefit for these men because it achieves a maximal resection of prostate that opens up the bladder neck and the bladder outlet that really allows them to empty better than other options. Surgical resection of the prostate has been around for well over 100 years, first starting with open abdominal incisions for resecting prostate, and then as technologies advanced, they were rapidly adopted to afford minimally invasive approaches for resection of the prostate. This helped patients in regards to shorter recovery, shorter hospital stay, but we also found that with many less and less invasive prostate treatments, there was less and less prostate resected. This led to earlier regrowth of prostate tissue that had recurrence of bothersome urinary symptoms and in many cases need for a repeat surgical treatment. Because of this, in the 1990s, HoLEP was developed, which borrowed the surgical techniques of resecting along the prostate capsule and applied them in a minimally invasive technique using cystoscope and a high-powered laser. This afforded the improved maximal resection of prostate tissue without making any incisions on the outside and allowing for a much faster recovery. HoLEP is done in the operating room under general anesthesia, which means that the patient is entirely asleep. The patient is then observed in the hospital, usually for just one night, to ensure that bladder spasms and bleeding are not overly bothersome. And then on the day after surgery, the majority of men have their catheter removed for a trial of urination. If they're able to urinate, then they can be discharged home without a catheter. And most, if not all, men are able to discontinue all of their medications for urinary symptoms immediately at time of discharge. While HoLEP is new to the state of Georgia, it's been around long enough to establish a solid track record for safety and effectiveness. Studies have shown that in addition to the best retreatment rates of any minimally invasive procedure, HoLEP also has the shortest hospital stay, shortest catheter duration, lowest blood loss, among other factors. For example, TURP, which is considered to be the gold standard for treatment of enlarged prostate, has a retreatment rate around 15% at 5 years, and many of the other newer minimally invasive approaches have similar retreatment rates of 5 to 15% at 5 years. Compare this with HoLEP, which at 10 years the retreatment rate is less than 1%, really reflecting the optimal resection and decreased rate of regrowth following this procedure. And so generally I consider it to be the best combination of minimally invasive treatment with maximal resection of the prostate, leading to the best outcomes long term.